Good afternoon, everyone, and thank you very much for the invitation to speak here this afternoon. So I'm a council member of the Global Network of Public Health Nursing. My name is Helen Mulcahy, and I'm a senior lecturer in community health in University College Cork in the School of Nursing and Midwifery. My clinical background is in public health nursing, which is why I'm connected with a global network of public health nursing. So the Global Network of Public Health Nursing is a professional membership organisation connecting public health nurses and health visitors worldwide. It's focused on the strengthening practice, policy, research, leadership and education. So while I'm representing Ireland and I'm here, we do have representation from around the world. And there's a couple of bits missing here as well. We have public health nurses all over the globe, really. And there's quite a few missing from Africa. We have Malawi and Kenya, and we've got Iceland and Greenland represented as well. So there is some form of either public health nursing or health visiting in most countries in the world, but there's different terminology used to describe what are public health nurses. And you will see some examples down the side here from health visitors, schools nurses, public health nurses, lady health visitors in Pakistan, public health nurses, maternal and child health nurses in Australia, plunket nurses in New Zealand, and so on. Most have some kind of preventative or mainly preventative role, but there are those who have a clinical remit as well, like we have here in Ireland. So in terms of global public health nursing service, the main characteristics are the universality of the service. So it's provided on the basis of need rather than ability to pay. And usually it's a lifespan approach, from cradle to grave as described. It considers the individual in the context of their family and community. So we really are connected with the determinants of health. The approach is holistic and it's delivered in the form of home visiting, school or clinic-based work. As I said, determinants of health are critical to the role, and the focus is on providing prevention mainly and health promotion rather than curative services. Go right back to primary prevention. The activities of the Global Network of Public Health Nursing. So the aim of the network is to support public health nurses in developing their practice wherever they work in the world through the sharing of knowledge and public health nursing practice. It's mainly about networking about professional, educational and research issues. We share public health nursing resources and expertise from around the world. We want to foster mutual support regarding policy changes, and we plan biannual conferences to build the network and raise the profile of public health nursing internationally. This has been one of the successes of the network, I think. The organization first started back in 2009 when one of our council members, Professor Kari Levine from Oslo, came up with the idea at a public health nursing conference to develop a network, and that's where it started really. And it was further developed at the Public Health Nursing Conference in Michigan in the USA in 2011. But it wasn't until the conference came to Ireland in 2014 when it was actually launched by President Michael D. Higgins, and the constitution of the network was developed at that particular point. Then there was a very successful conference in, it should be Billund rather than Billund, in Denmark, and onwards to Nairobi and Japan. And our next conference next year will be in Calgary in Canada. So we have tried to spread ourselves around the world as much as possible. The challenges and solutions for delivering impact, building membership capacity sufficiently is a challenge, I think, for any organization, and we're working hard at an individual level with trying to reach out to our local, our regional, our national networks to try and increase membership. We want to develop professional interest in global agendas, and the factors influencing nursing globally affect each of us individually in our own countries as well. Obtaining sufficient funding is a challenge for any organization, and our funding mainly comes from membership fees and the conference funding. Motivation and interest. This is a challenge for any organisation, and I previously belonged to the Institute of Community Health Nursing here in Ireland, and that was an organisation that reached out to public health nurses nationally, and they were part of the founding of the Global Network of Public Health Nursing. But the challenge is a very small number of public health nurses in Ireland. There's only 1,900 forward-facing public health nurses, so it's very hard to sustain an organisation with such small numbers. But certainly the Institute were instrumental in getting the global network off the ground. So the solutions, as we would see it, relate to funding for some staff within the organisation, and the establishment of regional chapters. We're hoping to have a chapter at least in every continent in the world to drive the organisation at that level. So our membership, we're very conscious as well that, you know, we come from high-income countries, and we want to make sure that we have, you know, that we make it accessible to everybody. So we have a variety of membership rates that are designed to attract people from all incomes. And that's it. Our next conference is in Calgary, and we'll share the QR code later. Thank you very much.